Today I'm going to talk about periodontal disease and more specifically how a dog's diet might influence its dental health, which is a subject that's often underestimated in veterinary care but affects the majority of dogs. We often think of brushing, dental chews, or having their teeth cleaned at the vets when we talk about oral care, but what about the food we put in our dog's bowls every day? Diet is one of the most consistent, controllable aspects of a dog's life, and yet its role in dental health is still under-researched and often overlooked. I chose this topic because as a dog owner and dog groomer of nearly 10 years, I've started to notice how conflicting the conversation has become, especially around raw feeding versus kibble. Some people swear by raw bones for clean teeth, while others stick firmly to vet-recommended kibble with dental additives. But the question is, what does the science actually say? My goal with this presentation is to break that question down by looking at what we know about periodontal disease, examining how different types of diets interact with dental anatomy and microbiology, and identifying where the gaps in research still lie. Ultimately, I want to explore whether feeding choices can be used not just to nourish dogs, but to prevent one of the most common and damaging conditions in canine health. So let's begin by understanding what periodontal disease actually is and why it's such a major issue. Periodontal disease is one of the most prevalent health conditions in domestic dogs, affecting up to 80% of those over 3 years old. While brushing and professional cleanings help, diet remains one of the most consistent and modifiable factors in a dog's daily life. Over the last decade, raw feeding, often called BARF, or biologically appropriate raw food, has gained traction with claims that it mimics evolutionary feeding habits. Advocates believe that raw meat and bones clean teeth naturally. On the other hand, veterinary professionals often recommend specially formulated dry kibble dental diets, which include ingredients to combat plaque. What makes this topic especially relevant today is the shift in pet ownership trends. Many dog owners are becoming more proactive about canine health and are questioning standard veterinary recommendations. There's an increase in home-prepared meals, raw food deliveries, and even homemade dental chews. But while innovation is booming, research is lagging. As popular as this debate is, the literature remains underdeveloped and inconsistently explored. My presentation aims to determine whether diet really affects dental health, and if so, how. To truly understand how diet affects dental health, we first need a clear picture of what periodontal disease actually is, what causes it, what triggers it, and what's going on at a microbial level. Periodontal disease is a chronic inflammatory condition that affects the supporting structures of the teeth, the gums, periodontal ligament, and the alveolar bone. It's not just a dental problem, it's a progressive condition that can impact a dog's entire body if left untreated. The root cause is plaque, a sticky film composed of food particles, saliva, and most importantly, bacteria. Within hours of eating, plaque starts to form on the teeth. If it's not removed by chewing, brushing, or cleaning, that plaque begins to harden into tartar, which is much harder to remove and becomes a breeding ground for pathogenic bacteria. The key bacterial players in canine periodontal disease are anaerobic gram-negative species, especially Porphyromonas gulli, Treponema denticola, and Fusobacterium nucleatum. These bacteria thrive in oxygen-poor environments, like the gum pockets that form when plaque starts pushing the gum line back. As they colonize these areas, they release toxins and enzymes that destroy gum tissue and bone. But the real damage isn't just from the bacteria, it's from the dog's own immune response. As the body tries to fight off these invaders, it sends white blood cells and inflammatory cytokines to the area. Over time, the immune activity breaks down connective tissue and bone, so ironically, the immune system ends up causing much of the destruction it's trying to prevent. There are several risk factors that accelerate this process: poor diet, lack of mechanical chewing, absence of brushing, genetic predisposition, especially in smaller breeds, and age. But diet plays a uniquely influential role. It affects plaque accumulation, bacterial growth, salivary pH, and even systemic immune responses. And here's something critical: once the disease advances to periodontitis, the damage is irreversible. We can slow or halt it, but we can't undo bone loss. That's why early prevention through dietary choices and oral hygiene is essential. Understanding the interplay between bacterial colonization, immune response, and mechanical plaque removal helps us see why feeding strategies are more than just nutrition. They're dental interventions in disguise. Before we dive into how diet influences dental health, it's important to understand the basic anatomy of a dog's mouth, not in terms of counting individual teeth, but in terms of how their dental structure works and why it's different from ours. Dogs are carnivorous animals by evolution, and their mouths reflect that. Their teeth are built for gripping, tearing, and shearing, not grinding like ours. Unlike humans, dogs don't chew in a rotary motion. Their jaw moves mostly up and down, which is great for slicing meat and cracking bone, but not ideal for grinding plant material or slow, thorough chewing. This means that the mechanical action of chewing, which helps remove plaque in humans, is less naturally built into a dog's chewing habits unless we give them the right textures to chew on. Dogs also have a relatively high bite force, especially in the back of the mouth where the molars and carnassial teeth are located. That makes them capable of breaking down tough items like raw bones or dense chews, but also makes them vulnerable to tooth fractures if they're given overly hard items. Another important point is that saliva in dogs doesn't contain enzymes like amylase the way human saliva does. So food doesn't start breaking down in the mouth, it just passes through. That means any residue left on the teeth stays longer, and without mechanical disruption like chewing on something coarse, it quickly becomes plaque. Let's talk about dry kibble, the most widely used commercial dog food on the market today. It's easy to store, affordable, and widely available, which makes it the go-to choice for many dog owners. From a veterinary standpoint, kibble is also the most studied diet type in relation to dental health, especially when it comes to specially formulated dental diets. Dental-specific kibbles are designed with certain features to help reduce plaque and tartar. These often include a larger, more fibrous kibble shape that encourages chewing, as well as chemical agents like sodium hexametaphosphate or zinc salts, which bind to calcium in the saliva and help prevent mineralized plaque, also known as tartar, from forming. That said, the mechanical cleaning effect of kibble is limited. Most dogs, especially smaller breeds, don't chew kibble thoroughly. Many just crush it once or swallow it whole, meaning the food often bypasses the very teeth that need the cleaning action. So while it can help to some extent, it doesn't reach below the gum line or clean the hard-to-reach areas like the back molars. Another important factor is that most kibble contains a high percentage of starches and carbohydrates, which bacteria like Porphyromonas schooly feed on. These carbohydrates can stick to the teeth, especially along the gum line, and fuel plaque formation, essentially feeding the problem we're trying to prevent. So while dry kibble, especially dental formulas, may slow down disease progression and is backed by the most evidence, it's far from a complete solution. It works best when combined with brushing, regular cleanings, or diets that encourage more natural chewing behavior. Wet food is often seen as a convenient and highly palatable option, especially for older dogs, picky eaters, or dogs with dental pain who struggle with harder foods. It's soft, easy to eat, and comes in a wide variety of flavors and formulations. But when it comes to dental health, wet food consistently performs the worst across multiple studies and clinical observations. One of the main reasons is its texture. Because wet food is soft and smooth, it requires almost no chewing, which eliminates any opportunity for mechanical cleaning. It simply slides over the teeth, leaving behind a coating of food particles and moisture that easily adheres to enamel, especially along the gum line. Another major factor is the high moisture and carbohydrate content. Wet foods often include thickeners, starches, and sugars to improve texture and flavor. These components are highly fermentable and feed acid-producing, plaque-forming bacteria like Fusobacterium nucleatum and Porphyromonas gulli. Over time, this combination of food residue, low abrasion, and high bacterial activity accelerates plaque accumulation and increases the risk of gingivitis and periodontal disease. Studies have shown that dogs fed primarily on wet food tend to have higher rates of gum inflammation, more tartar, and more advanced periodontal disease, especially when not paired with brushing or other oral care measures. So while wet food may be useful in specific contexts, like dogs with missing teeth or medical conditions, it poses clear risks to dental health if used as a primary long-term diet without additional oral hygiene support. Raw food and raw bones have become increasingly popular among dog owners, especially those seeking a more natural and evolutionary approach to feeding. Proponents argue that raw diets mimic what dogs' ancestors would have eaten in the wild: raw meat, cartilage, and bones, and that this kind of feeding supports overall health, especially dental hygiene. From a mechanical perspective, there's solid reasoning behind this. Chewing on raw meaty bones forces dogs to use their premolars, molars, and carnassial teeth in natural shearing and crushing motions. This action scrapes away the plaque and massages the gums, providing mechanical cleaning that processed diets often fail to offer. Some studies and case reports have shown impressive results, such as up to 88% reduction in dental tartar after just a few weeks on a raw meaty bone diet. Additionally, because raw food is typically low in starch, it doesn't feed the plaque-forming bacteria in the same way high carbohydrate diets do. This could lead to a more balanced oral microbiome, but it's not without its risks. Dental fractures are a common concern, especially if dogs chew on bones that are too hard, like weight-bearing bones from large animals. There's also the risk of bacterial contamination, including Salmonella and E. coli, which pose health threats not only to dogs but also to the humans in the household through handling and cross-contamination. Nutritional balance is another issue. Home-prepared raw diets that aren't formulated correctly can lead to vitamin and mineral deficiencies or imbalances over time. For this reason, veterinary nutritionists stress the importance of using formulated, complete raw diets rather than DIY meals. When we think about dental health, we often focus on the visible issues: plaque, tartar, and bad breath. But behind those symptoms is something much more complex: the oral microbiome. The mouth, like the gut, is home to a vast community of microorganisms. In healthy dogs, this microbiota stays balanced. Good bacteria help protect the tissues, control inflammation, and outcompete harmful species. But when the balance is disrupted, often by plaque buildup or dietary changes, we get dysbiosis, an overgrowth of pathogenic bacteria that drive periodontal disease. Key players in this microbial imbalance include species like Porphyromonas gulli, Fusobacterium nucleatum, and Treponema denticola. These bacteria thrive in gum pockets and produce toxins that break down gum tissue, trigger inflammation, and worsen disease over time. This is where probiotics come in. Probiotics are beneficial bacteria that, when introduced in the right strains and amounts, can help restore microbial balance. In recent studies, certain canine-specific strains have shown strong potential for oral health. One example is Lactobacillus acidophilus (MJCD175), a probiotic isolated specifically from dogs. In lab studies, it's been shown to inhibit biofilm formation by harmful bacteria and reduce inflammation. Another promising strain is Lactobacillus plantarum (CECT9161), which, in a controlled trial involving 60 dogs, led to significant reductions in plaque, gingival inflammation, and tartar after supplementation. Unlike brushing, which only affects surface plaque, probiotics have the ability to modulate the entire oral environment, changing which microbes dominate, influencing immune responses, and potentially reducing the need for more aggressive interventions. Prebiotics and postbiotics, which support or mimic probiotic function, are also showing early success. For example, a prebiotic seaweed called Ascophyllum nodosum has reduced plaque and gingivitis in trials when added to food or chews. Although this field is still developing, the idea is clear. By supporting a healthy oral microbiome, we can help prevent periodontal disease from the inside out. Probiotics aren't a magic fix, but as a part of a broader oral care strategy, they represent one of the most exciting tools we have. Now that we've looked at dry kibble, wet food, raw diets, and microbiota-based interventions like probiotics, let's take a step back and compare these approaches side by side. Starting with dry kibble, it's the most commonly used and most clinically studied option. Special dental formulas can help reduce plaque and tartar through added chemical agents and slightly enhanced texture. But the mechanical cleaning effect is limited, especially in dogs that swallow their kibble whole. But because most kibble is high in starch, it can actually fuel the growth of plaque-forming bacteria. Next is wet food, which consistently performs the worst in terms of dental health. Its soft texture doesn't encourage chewing, and it often sticks to the teeth, creating a perfect environment for harmful bacteria. High moisture and carbohydrate content further promote plaque development. Wet food may be necessary for dogs with missing teeth or medical conditions, but it should be paired with other dental care strategies. Raw diets and raw meaty bones show the most promise when it comes to mechanical plaque removal. Dogs fed raw bones engage in natural chewing behaviors that clean the teeth and stimulate the gums. These diets are also typically low in starch, which helps support a healthier oral microbiome. But they carry more risk: fractured teeth, bacterial contamination, and nutritional imbalances if not properly formulated. And while anecdotal evidence is strong, robust, long-term clinical trials are still lacking. Then we have probiotics, prebiotics, and symbiotics, which are emerging as powerful biological tools. They don't replace brushing or chewing, but they can complement a dental care routine by supporting a healthier balance of oral bacteria. Early studies are showing reductions in plaque, inflammation, and pathogenic species with specific canine-targeted strains. Still, more research is needed to determine optimal strains, doses, and delivery methods. In short, no single option is perfect. Dental kibble is safe and somewhat effective, but limited in scope. Wet food is convenient, but the worst for oral health. Raw diets offer real benefits, but come with safety concerns. Microbiota modulation is an exciting frontier, but still in the early stages. The best approach likely combines multiple strategies, leveraging mechanical, nutritional, and microbial tools together to create a comprehensive, individualized dental care plan for each dog. Despite growing interest in how diet affects canine dental health, there are still significant gaps in the research, and these gaps limit our ability to make strong evidence-based recommendations. The most obvious issue is lack of large-scale, randomized, controlled trials directly comparing dry, wet, and raw diets. Most existing studies are small, short-term, or observational. That makes it difficult to draw definitive conclusions about long-term effects, especially across different breeds and age groups. There's also a major lack of research on raw diets. While raw feeding is popular among certain communities, most of the support for it comes from anecdotal reports or small-scale case studies. We need more data on safety, effectiveness, and long-term outcomes, particularly regarding dental fractures, bacterial contamination, and nutritional adequacy. Another gap is the limited understanding of breed-specific chewing behaviors. A small dog that gulps food and a large dog that crushes bones have very different dental risks and dietary needs. Yet most studies treat dogs as a uniform group, without adjusting for these behavioral or anatomical differences. We also don't know enough about the oral-gut microbiome connection. We're learning that the bacteria in the mouth may be linked to those in the gut, and that systemic inflammation can affect oral tissues, but these interactions remain poorly studied in dogs. Finally, very few studies account for real-world variables, like owner compliance, brushing habits, socioeconomic factors, or access to veterinary care. A diet may work in a lab, but will it work for a busy owner with limited resources? In summary, while we know that diet does impact dental health, we still lack the depth and breadth of research needed to create personalized, risk-based feeding strategies. Future studies should aim to fill these gaps so that dietary choices can be tailored more precisely and with greater confidence for every dog. In conclusion, the evidence shows that diet plays a crucial role in canine dental health. While dental kibble offers moderate plaque reduction and wet food generally worsens oral outcomes, raw feeding emerges as the most effective for mechanical cleaning. Chewing raw meaty bones closely mimics natural behaviors, scraping plaque away and engaging the full dentition. Raw diets also appear to support a healthier oral microbiome, likely due to lower starch content and natural chewing action. However, these benefits are tempered by the need for careful management, selecting appropriate bone sizes, managing hygiene, and ensuring nutritional balance to avoid fractures or bacterial contamination. For owners who are unable or prefer not to feed raw, a good alternative is the use of dental formulated dry kibble combined with regular toothbrushing, as this approach still provides moderate plaque control. Wet food, by contrast, should ideally be limited or paired with additional dental care measures, as its texture tends to encourage plaque buildup. Probiotic supplementation is also worth considering alongside any diet, as emerging research suggests it may help balance both oral and gut microbiota, potentially reducing inflammation and supporting overall oral health. Ultimately, while raw feeding shows the strongest potential benefits, the best outcomes are likely to come from combining diet with other dental hygiene strategies tailored to the individual dog. Although we've come a long way in understanding how diet affects dental health in dogs, it's clear that the science is still catching up to the real-world questions dog owners and vets are asking. That's why outlining future research priorities is so important. First, we need large-scale, randomized, controlled trials comparing dry, wet, and raw diets in terms of long-term dental outcomes. Right now, most studies are short-term or observational, which limits the strength of their conclusions. We need data that shows not just what works for a few dogs, but what works reliably across diverse populations. Second, there's a pressing need for long-term safety and effectiveness studies on raw diets, especially those involving raw meaty bones. These diets may offer strong mechanical benefits, but we need to better understand the trade-offs, like fracture risk, bacterial exposure, and nutritional imbalances over time. Third, more attention should be paid to the oral-gut microbiome connection, the relationship between the bacteria in a dog's mouth and its overall immune system is still poorly understood. Exploring how systemic inflammation and gut health affect periodontal disease could unlock new prevention strategies. Fourth, breed and age-specific studies are needed. A Chihuahua doesn't chew like a Labrador, and senior dogs don't process food the same way as puppies. Tailoring feeding and dental strategies based on breed, size, skull shape, age, and chewing behavior could lead to much more effective care. Fifth, we need to explore the practical application of probiotics and symbiotics. What strains work best, what doses, how often? Are oral supplements more effective than water additives or dental treats? These are key questions that future studies should address. And finally, research needs to start factoring in real-world variables, things like owner brushing habits, access to dental products, and socio-economic barriers. A perfect diet doesn't help if owners can't maintain it or afford complementary care. In short, we need research that goes beyond the lab and reflects how dogs actually live, so that we can create dental care strategies that are not only effective, but also realistic, safe, and sustainable.